Hello and welcome to the Herbal Clinic MD. I'm Dr. Mark Hashim. Today I'd like to talk to you briefly about how I like to treat our patients who suffer from PTSD. PTSD is a very common problem. It's not only associated with battle situations, the military, it's also associated with our first responders, and a number of people suffer from what we call cumulative PTSD. That's being repetitively abused either in a family situation, in a marriage situation, or any situation that you're constantly exposed to. Then you develop a lot of anxieties. This creates the inability to function in society and the inability to sleep properly. So what I do is I direct our cannabis medication around the problem and try to help the patients out. The first thing you always want to do, correct sleep. Sleep is a major problem, and if we can sleep better, we're going to heal better and we're going to feel better. I always recommend that the patients usually use indica, the strain indica, at nighttime before bed. They can vape or smoke the actual flower. That will help them fall asleep. Now, in order to stay asleep though, I recommend that you also use some sublingual drops of indica. That'll allow you to stay asleep. So think of vaping to fall asleep, drops to stay asleep. Now that we're sleeping well, when we wake up, hopefully we're feeling better with less anxiety. But to make sure that we have less anxiety throughout the day, I also recommend that the patients start off their day with CBD. This will quell the anxieties and allow you to function without any high during the day. If you need to, you can also carry a vape pen of CBD around, because any time that you're exposed to a situation that increases your anxiety, that you want to escape, I say vape to escape. Use your CBD vape pen to escape, to get a quick onset and allow you to function in that situation. That's the main way that I like to advise patients to deal with their PTSD. Obviously, some patients like to use some higher THC strains to deal with that, and that's perfectly acceptable. But I do want to warn some of our PTSD patients. The strain sativa sometimes can make your anxieties worse. And remember, if you ever feel bad from taking a certain strain, you don't feel right in the head, or you feel more anxious or paranoid, the antidote is CBD. So you can also take some CBD to quell that. In general, I tell the patients, take CBD during the day, use indica at night, and if you want to, play around with different strains, and remember, the way to get out of any situation is to use some CBD. So that's my instructions for how to treat your PTSD on a daily basis. Good luck.